Welcome back to the Morning Blend. There are different kinds of dentures, but there's a breakthrough type that's called facelift dentures. These dentures promise to give you facial support that does it all. Plumps your lips, lessens wrinkles, even helps fill out your face.
How's that look? Like that? That looks good. All
Better
right,
than that.
Patients, however, swear that they're the fountain of youth for denture wearers. And here with more on that and other dental wonders is Dr. James Michaels and dental assistants Danielle Wagner and Tara Olson from Oconomowoc Dental Care. Thanks for being here, you guys.
Thank you.
So,
Thank
is this
you.
your whole
Thanks for
office
having
here?
us.
I mean, is anybody
Oh, no.
manning the
Oh, no,
chair?
there's more.
Just
All
brought
right.
the superstars.
Yeah, just the ones who get out for the day. Yeah. Well, let's break it down. I think so many people, we talked the other day about dental care in general, that a lot of people shy away because of the cost.
Oh,
It's
yeah.
expensive.
It's very expensive. It's terrible. Everything is expensive now.
I love that you
know what I
admit
mean?
that.
Well, it is, but I got a great way to save money with dentistry, and it's not what you think.
Okay.
I see patients every day, many times every day, who have big cavities that need big fillings, or worse, need root canals, or worse, need crowns, or even worse than that, need to be taken out because I can't fix it anymore. And then they need to either go without a tooth or get an expensive implant. You know, that's when your costs really ramp up.
Yeah.
And every time I see that person, I just ask myself, God, if I could just, and I don't say this out loud, of course, but I think if I had just seen this person a couple years ago, I could have fixed it with a simple little filling, you know?
Yeah.
Very inexpensive, not a big deal.
And that's a reason to see the dentist regularly.
Yeah,
I mean,
yeah.
you know, it's something that seems like
Yeah.
all dentists hammer. We hear it in the news all the time, but it's true. If you go every 6 months for a regular checkup and pay that minimal fee, you can prevent a lot of the expensive stuff.
You know, it costs less to see us once every 6 months than to get your hair cut. You know what I mean? And we'll see it while it's a little bitty thing, when it's easy to fix and doesn't cost much money. So that's a great idea to save money in dentistry.
I think that's a great idea, and it's good to just be preventative like that. Let's get to this facelift.
Yeah, isn't that
because
cool?
people,
Yeah.
you know, a lot of people talk about how can we improve the look of our face, how can we do
Right.
things simply
Well, let me
with a
tell you a
denture.
little bit. Let's say someone's lost all their teeth, right? And they have dentures or need dentures. Guess what happens when you lose your teeth?
Your face sinks.
Well, the bone that holds your teeth in goes away too. And then your lips and face, everything between your nose and cheeks, kind of like caves in like that. And then you start to see, we call it purging of the lips, creases here. Maybe you've seen someone who has this chronic red in the corner of their lips. It's because the lips are closing too far. And then the distance between your nose and the chin decreases, and, well, you know.
So how do facelift dentures work then? Because here's an incredible example.
Oh, yeah, it's amazing.
Wow.
Yeah. Well, this is a combination of two things. It's superbly constructed dentures, so the teeth look really nice.
She looks amazing.
But
this
what's
one.
really cool about this is it also reconstructs that lost bone and the proper tooth position to fill your lips and face out appropriately like it used to be before you lost your teeth.
So it's true facial support.
Yeah, provides
right? It's
support.
not just
Exactly.
teeth.
Yeah, exactly.
It's
I
not
should've thought
just
of
a
that.
set of teeth. It's facial
Yeah.
support. I mean,
Yeah.
that's incredible.
No, and it's really fun. Let me tell you, I'm not kidding. I have patients, I don't know, you know, and then we go ahead and do it, and before they come in, they don't smile, or they smile maybe like this,
Yes.
right? And then when they're done, they're like, I show them the mirror, and they're crying. I'm honest. It's really, really a lot of fun.
Yeah, I bet.
And what I see is a person's, personality just like evolve, and they're real again. They're like they used to be. They feel wonderful. That's really fun.
Well, a smile really is, an expression of who you are and how you're feeling. And if you're embarrassed to do that, or you cover your mouth, and we've all seen the people who even laugh kind of covering their mouth because they're embarrassed. And to see that transformation, I can imagine, means a lot to you guys. What is the iTera digital scanner, and how is that beneficial?
It is brand new technology we just brought into our office. It allows us to take impressions without the goop, the trays in the mouth. It scans the teeth, takes pictures of the teeth with amazing accuracy.
That's incredible.
Yeah.
I hate
remember
the
the
goop. I was just gonna say.
No one likes it.
Yeah.
So there are lots of times we need to take impressions of people's teeth, right? And this optical scanner eliminates all that crud in your mouth.
Yeah.
Okay?
Wow.
Yeah.
Yeah.
That big thing, the drooling, and it's awful. Some people
Yeah.
are so gaggy, they
Yeah.
have to sedate them just to take an impression, because the idea of anything in their mouth, it's horrible.
Yeah.
But what's really, really cool about this is there's intrinsic inaccuracies associated with impressions. I mean, the new impression material that we have now is really amazingly good, but it's not perfect. So we optically scan it. We turn this information into digital data, and they're able to produce restorations like crowns that are so accurate. It's amazing. I think time will tell. But I think these crowns are going to last people forever.
That
between the accuracy of the crown and these new cements that we have, I mean, it's just amazing. It's the most exciting thing. I'll tell you, I'm not kidding. In my whole life in dentistry. I mean, this goes way back to when they invented the. You remember
the automobile?
Yeah, I'm bad about that. No, there was a big thing about 30 years ago when they came out with these pneumatic drills, you know, the high-speed drills, and they got rid of the cables, you know.
Yeah.
That was a big deal in dentistry. This is about like that.
One of the extreme examples is something called meth mouth. People use methamphetamines. Do you ever see that?
Well, we're out in the burbs, you know, the suburbs out in Oconomowoc. But even out there, I'm starting to see meth mouth. Do we have a picture? Yeah.
That looks horrible.
It's like the perfect storm of tooth decay.
Ugh.
Yeah. When someone's taking meth, it does a few things. It dries out your mouth. It constricts the blood vessels, so the blood supply to your teeth and gums almost goes away. They grind their teeth like crazy. You know, they're not brushing their teeth hardly ever, so hygiene is awful. And then they get these sugar cravings. So in a matter of, I remember one patient, I placed 24 fillings for this young fella. And I saw him 6 months later, and there were a dozen giant cavities right next to the fillings I had just put in just 6 months. You know, it was I was just like, I didn't know what to do. Yeah.
That's a reason to avoid using substances like
and you
that
know what's
if I ever
almost
saw
as bad?
one.
Soda. Soda, yeah.
Yeah.
It just destroys your teeth. It's the sugar, of course, but mostly it's the acid in the soda. So diet soda will do it too. And I see patients almost every day with decay between the teeth and along the gum line. And when I see that decay pattern, I know it's soda. And so we have a conversation about it. And then once they stop drinking the soda, it doesn't happen again. It's just fantastic.
Well, and here you think you're doing yourself a favor drinking diet. We ran out of time, but I want to make sure everybody has the information so they can contact you. If you'd like to get a hold of Dr. James Michaels at Oconomowoc Dental Care, here's how you can do so. It's 262-567-7224. He, Danielle, and Tara, and their wonderful staff there would love to see you. So there's the information. Thanks so much for being here, you guys.
Thank you for having us.
Nice to meet you guys. Thank you so much.